Deliver blood, which contains nutrients and oxygen to all the cells of the body, and also then to remove from those cells carbon dioxide and other waste products. So what we're going to do is we're going to build this up from sort of a basic outline of the circulatory system to more realistic versions in the next few slides. So this first one is just sort of obviously just boxes to show sort of the general path that blood follows as it goes through your entire circulatory system. We're going to start on the right side of the heart. Okay, remember it's reversed because it's like it's inside of somebody. So we're going to start on the right side of the heart. So the chambers here, there's 4 chambers, 1, 2, 3, 4. The upper chambers here are called the atrium. Atria is plural actually. But in each atrium, they are the collecting chambers. An atrium is an entryway, like you may have heard that word, like a hotel or a big house. The atrium is like the main lobby that you come in, the big open space. It's an entryway. The atrium is where blood enters the heart. So this is the right atrium. And the right atrium collects blood from throughout the body. And that blood, because it's coming from various cells in your body, from your brain and from your calf muscle and from your kidneys and so forth, because it's coming from those various parts of the body, it's deoxygenated. Meaning it's low in oxygen. But what is it probably high in?
Carbon dioxide.
Yes. So it's low in oxygen, but it's rich in carbon dioxide because it just picked up that waste from all these various parts of your body. Okay? So after this blood collects in the atrium, it gets moved down through a valve here. This is a one-way door that allows blood only to go in one direction here. Into the right ventricle. This is the right ventricle. And where is that blood need to be sent?
To the lungs.
Yes. It needs to be sent to the lungs. Because again, it's low in oxygen and high in carbon dioxide, so it needs to go over to the lungs. So it does. It gets pumped out through some blood vessels up to the lungs.
Did we have to like draw those lines?
Yeah, well, you can just draw one loopy line. It doesn't need to be 3 separate arrows. Just draw
I don't know, like those lines are like.
Oh, sure, the valve? Sure, draw the valve.
I drew them.
All right, so this blood gets sent down to the lungs. We just talked about the respiratory system. All those little blood vessels that surround the alveoli, that's where this blood's going, into those tiny little blood vessels. Once it's there, what happens to the blood? Shane?
It's oxygenated.
Gets oxygenated and something else. Well, before that, Noreen gets rid of the carbon dioxide. So releases carbon dioxide and picks up oxygen. Now I'm starting to use red as my color now because that's sort of the convention. We use red for oxygenated blood. We generally use blue for deoxygenated blood, even though it's a fallacy that deoxygenated blood is not really blue. It's a fallacy that it is blue. It's not. It's a dark red. It's a purplish kind of color, but it's not blue when it doesn't have oxygen. Even though lots of people say that, that's not 100% accurate.
Is it when it has oxygen?
When it has oxygen, it is bright red. When it doesn't have oxygen, it's a dark red or like a purpley color, but not blue.
Like our veins?
No, your veins look bluish or greenish because of the way light travels through your skin.
Like, say you weren't breathing, like, would you like skin like through like a different like color?
Yeah, you get pale because that blood is low in oxygen. All right. So once this blood has reached the lungs, it's got new oxygen, it's gotten rid of the carbon dioxide, it's kind of like recharged. Where do you think it's headed next?
Left side.
Yes, headed back to the heart again. This time, though, it goes to the opposite side. It goes over to the left side of the heart. The left atrium collects blood from the lungs. How can you describe this blood that's coming from the lungs?
Fully oxygenated.
Oxygenated, so it is high in
Oxygen.
low in.
Carbon dioxide.
Right. Again, it goes through a one-way valve from the atrium into the ventricle. And now this blood is ready to leave the heart again. This time, where is it headed?
Throughout your body.
Headed all throughout the body. All parts of your body. So let's say when some of this blood reaches your skin cells, or cells in your liver, or cells in your brain, or in your calf muscle. What happens with that blood? Raise your hand and tell me. How does that blood change once it does reach those body cells? Shane already answered. Well, somebody new. So what happens once this blood reaches your body? Changes. Abby?
It gives oxygen to the cells.
Gives its oxygen to the cells and
Takes the carbon dioxide of the cells.
right. So its oxygen level decreases, okay, and its carbon dioxide level increases. It's kind of the opposite of the lungs. Gives the cells oxygen, removes their waste.
Do you ever think that
All right, so then where is it headed?
back to the right side?
Back to the heart again, and we've completed our circulatory loop. Collects back in the right atrium, then this deoxygenated blood gets sent to the lungs, back to the heart, to the body, heart, lungs, heart, body, and repeats over and over again. Go on.
How long does it take?
Oh, it takes, I don't know, probably for blood to make one complete cycle, a minute or two maybe.
Oh, wow. That's kind of quick. No, we're top one.
All right, so this is the basic. This is sort of the outline of where blood goes and what happens to it. But now we need to start to talk about the actual, that just shows the transitions. Talk about some actual anatomy.
Whoa.
So this is slightly more realistic in terms of what it looks like, although it's not really great, but it gets us there. So we need to name the parts of the heart and major arteries and veins. Now I want to talk about something first though, some words. First one, does anyone know what CPR is?
Yeah.
Okay. Do you know what it stands for?
Cardio.
Cardio. What is the second?
Respiratory.
Cardio. Pulmonary.
Oh,
Yeah,
respiration.
Not respiration. Resuscitation. Cardio meaning heart, which are the chest compressions. Pulmonary meaning lungs, which are the breaths into the lungs. Resuscitation meaning to revive. Okay? So pulmonary has to do with the lungs. That's an important thing to know because we'll talk about this in a minute. The other distinction, arteries versus veins. For now, I just want you to know one thing. And the main difference between the two is the direction that they carry blood. Arteries always carry blood, you know, which direction?
Throughout the body.
Away from the heart. So remember, A for artery, arteries carry blood away from the heart. Veins carry blood to the heart. All right, that's going to be another important distinction. Okay, so let's start here. This chamber of the heart, raise your hand if you can tell me what it's called. This one. Raise your hand. Anybody? Laura?
right atrium.
Yes, that's the right atrium.
What's all yours?
All right?
Not cool.
Down here, raise your hand. What chamber is this? Matt? No? Oh, yeah, sorry. Right ventricle. And in the heart, the atria are the entryways, the ventricles are the chambers that pump blood out of the heart. Okay, on this side, raise your hand. Megan?
Atrium.
Left atrium. Down here, Emily?
Left ventricle.
Left ventricle. Okay, easy enough, right? Chambers of the heart.
They changed the
All right, so let's talk about the path that blood flows. And we're going to start again in the right atrium. Now, it is a cycle, so you can really start anywhere and trace the path of blood. But in our notes, we're always sort of starting in the right atrium. So, this blood is collecting in the right atrium. That blood is deoxygenated. Then travels through a valve, a one-way sort of door that prevents blood from flowing backwards. The ventricle then pumps this blood out. Remind me, raise your hand, where is this blood headed from the right ventricle? Raise your hand, beyond. To the lungs. So, can anybody come up with the name of this blood vessel? Raise your hand. What's the name of this blood vessel? We just talked about how you can figure it out. Shane?
It's the P word. I forgot it
Okay.
already.
The pulmonary blood vessel.
Okay, close, but let's be more specific. It's called the pulmonary
Vein.
artery.
Yes.
Capillary.
No.
Yes.
Good.
Pulmonary arteries. Pulmonary because it's going where?
To the lungs.
Artery because it's going
Away from the heart.
away from the heart. So this is the pulmonary artery. It's bringing the blood from the heart out to the lungs. Now, after that blood gets to the lungs, it's going to return back to the heart.
That's a vein.
Raise your hand, hold on. So, let's name this. So we have blood coming back into the left atrium that came from the lungs. What's the name of this blood vessel, Donovan?
Is it like the cardiac vein?
No. So the blood's coming from where?
Lungs. Oh.
And going where? Okay, so what are we going to call it? Ruan?
Pulmonary vein.
It's a pulmonary vein. Pulmonary because it's lungs. Vein now because it's heading to the heart.
But it's going
To the heart.
Yeah.
Veins bring blood to the heart.
Why would it be?
Arteries bring blood away from the heart.
What's pulmonary?
That's coming from the lungs. Okay, goes through another valve into the left ventricle where it then gets pumped out. Where's this blood headed?
To the body.
Thomas?
The rest of the body.
All throughout the body. Now this blood vessel, first, would it be a vein or an artery? Raise your hand, please. Maya? It is an artery. It's an artery, though, with a special name. It's the main artery leaving the heart. You know what it is, Antonio? You did have your hand up, right? Okay. I think you guys probably learned I was asking how.
Is it the main body artery?
That's what it is. That's not its name.
It's
It's called the aorta. A-O-R-T-A.
I knew that. I just didn't want.
And the blood gets pumped out through the aorta, and off of the aorta are many branches of other arteries which carry the blood to various parts of the body.
I would have said that, but I didn't want to get announced.
So again, if we just follow the path of blood, we have these blood cells, just watch them.
That's where.
Right atrium, right ventricle. It's going through. What's it going through?
The
Pulmonary artery.
Pulmonary artery. They're headed where?
The lungs.
All right. Back to the heart. We lost one, but
Oh, no.
what was that?
Oh!
Pulmonary vein.
That was the
Pulmonary
pulmonary
vein.
vein. Now it's going out of the aorta.
Hole in one.
Sorry.
So when we look at how the heart functions, we have this repeated pumping of the heart that happens First by the atrium contracting, which pushes the blood, which collects the blood, then forces it into the ventricle. Then the ventricles contract, forcing that blood out to where it needs to go. So it happens, at rest about once every second. If you're exercising very hard, it may happen, up to 3 times every second. Your pulse rate varies from maybe about 60 or so at rest, up till, hard exercise, maybe 180, 190, 200, somewhere in that range. And again, the heart itself, because it's a muscle that's working hard and working constantly, it also has its own blood vessels that supply it with oxygen, because the muscle of the heart needs a lot of oxygen because it's working so hard. When those blood vessels get clogged, okay, that can lead to a heart attack. Donovan?
Since your heart is a muscle, can you take like steroids and make it stronger?
You can improve the efficiency of your heart not by taking steroids, but by exercising. Because as you exercise, your heart becomes more and more efficient at getting blood through your body. And if you can get a sense of your cardiac health by measuring your resting pulse rate. Somebody that's in good shape will generally have a lower resting heart rate than somebody that's not in good shape, because their heart is working more efficiently. It doesn't need to beat so quickly to distribute enough oxygen throughout their body. Matt?
What happens to your heart when you have heartburn?
Heartburn, nothing happens to your heart.
It's
Heartburn is called that, but it's really stomach acid creeping into somebody's esophagus, completely unrelated to the cardiovascular system.
Would doctors prescribe, not prescribe, give patient steroids because their heart wasn't functioning?
Not steroids, because the heart's not. There are medications a person can take for various. Yeah, Raina?
So because an overweight person has a higher risk of
Heart disease and stuff?
yeah. Is it because it works harder?
Partially, it's because it works hard. Partially, Sebastian, turn around and be quiet. Partially because there could be blockages within arteries. It could be because their blood pressure is higher. There's all sorts of factors that all sort of add up in that. All right, now let's talk about actual heart anatomy, what it really looks like. So this is what it really looks like. A little different from our other diagrams, but we can still pretty much name all of these parts. I'll also show you in the model of the heart. Let's start again.
Whoa. No need to throw things.
So if we start at the right atrium, it's here. You can see it, it's up here. Okay, this is my body, right atrium. Below it, right ventricle. Opposite side over here, left atrium. And below that, left ventricle. Okay, again, we'll start with the blood coming into the right atrium. So, we see that there are 2 main blood vessels that bring the blood into the right atrium. Okay, one here and one here. So where do you think, the one on the bottom, where do you think it's collecting blood from?
Your body.
Yes, but where specifically? Shane?
Like muscles.
Yeah, from the lower half of your body. That blood gets collecting your heart through this bottom blood vessel. The top one is collecting all the blood from the upper body. Okay? There's a name for this. It's called the Vena Cava. Is it a vein or an artery?
Vein.
It's a vein. It's bringing blood to the heart.
Wait, do we have to memorize?
Yes. It also, you guys should know, they have 2 different names. The one on top is called the superior vena cava. Label that. I know it's not on here. Label it. Superior vena cava. The one coming from the bottom, you can probably guess the name.
Less.
What's the opposite of superior?
Posterior. Inferior.
Inferior vena cava. This one is the inferior vena cava. So those 2 veins collect the blood from all throughout the body, bring it into the right atrium. And that blood gets pumped down through the valve into the right ventricle, and then up. Raise your hand, please, and tell me, what is the name of this blood vessel? Raise your hand. The next one, we follow the path. Sebastian?
Pulmonary artery.
These are pulmonary arteries. There are 2 of them. Can anyone tell me why there's 2? Why it splits here? Abby?
Because there's 2 lungs.
Yeah, because there's 2 lungs. One of these branches leads to the right lung, and the other leads to the left lung, bringing blood to each lung. All right, so that blood goes to the lungs, gets recharged, gets new oxygen, gets rid of carbon dioxide, and then it's headed back into the left side of the heart, the left atrium. You can see there's 2 entryways from this side and 2 from this side. Raise your hand if you could tell me the name for those blood vessels. Maya? Yeah, those are the pulmonary veins. Okay? Yeah, they bring the blood from the lungs back into the heart. Pulmonary veins. These are coming from the left lung, these are coming from the right lung. Okay, travels down into the left ventricle, it's pumped out through this large, raise your hand, tell me, is this an artery or is this a vein? Raise your hand. Laura? Artery. Special artery with a special name. Antonio?
Aorta.
Yes, that is the aorta.
Oh.
Now, it does, so my heart diagram sort of cuts out here, but what you'll see is it gets pumped out. Each of these, where do you think these
To the lungs.
branches lead?
To the upper part of the body.
Yeah, some to the brain, to the chest, to each arm. But then the aorta continues. It loops around. It's called the aortic arch. Loops around, and then it goes actually behind the heart, okay, and down to the bottom, which is heading to all the, yeah, you can see the end of it, to all the lower parts of the body. This one, it doesn't, you can't see that loop. It stops right here, but it would loop up and behind the heart, going to the lower body. Jonathan?
Were we supposed to draw those arrows?
Yes.
Yeah, that'd be helpful. Now, one other word. This dividing tissue between the chambers of the heart is called the septum. Okay, it divides the heart into a left and a right side.
Wait, don't end yet.
All right, this next little video clip gives you some additional information about how the heart works.
How does a human heart work?
About the size of your fist, the human heart is the most important muscle in the body.
Wait, it's in the middle?
It can beat more than 100,000 times a day, pumping about 2,000 gallons of blood through a 60,000-mile network of vessels in the body. The human heart is made up of 4 major chambers: the right atrium, right ventricle, left atrium, and left ventricle. The right side of the heart receives blood that is low in oxygen from veins all over the body. It then pumps the blood through the pulmonary arteries into the lungs, where it will become reoxygenated. The left side of the heart receives this oxygen-rich blood from the lungs. Then it pumps the blood through the aorta back out to the rest of the body through a complex network of arteries, arterioles, and capillaries. While blood is circulating through the body, it delivers oxygen and nutrients to tissue through the capillaries, and at the same time picks up carbon dioxide and other waste material. The veins return the deoxygenated blood to the right atrium, and the cycle begins again. The heart has 4 valves. Each valve is like a one-way door that keeps the blood in the heart flowing in the same direction. The valves are made up of 2 or 3 small but strong flaps of tissue called leaflets. Leaflets open to allow blood to flow through the valve and close to prevent blood from flowing backward. The opening and closing of the valves is controlled by blood pressure changes within each heart chamber. The tricuspid valve is positioned in the heart's right side, between the right atrium and right ventricle. The pulmonic valve separates the right ventricle from the pulmonary artery. The mitral valve is positioned in the heart's left side, between the left atrium and the left ventricle. And the aortic valve separates the left ventricle from the aorta. As blood circulates through the heart, some of the blood flows into a set of much smaller blood vessels that provide blood directly to the heart. These arteries, called coronary arteries, surround or crown the heart. This separate circulatory system, called coronary circulation, keeps the heart nourished and oxygenated. The two main branches of the aorta that nourish the heart are the right and left main coronary arteries. Coronary artery disease, which occurs when there is a buildup of cholesterol plaque, affects the arteries of this circulatory system and causes a decrease in blood flow to the heart muscle, resulting in possible damage to the heart or a heart attack. The beating of the heart, which is its rhythm, is regulated by electrical impulses generated by your heart muscle. These impulses begin in the sinoatrial node and cause your heart to contract. Sometimes the sinoatrial node is also referred to as your heart's natural pacemaker, since it keeps the heart rate constant and consistent. The impulses then travel to the atrioventricular node, where the signal is checked and then sent through the ventricles, which causes them to contract. Your heart rate can change